All right, I'm gonna do a quick video on what I call white plaque guy. It's a blood vessel model. And we're gonna stop right here, or start, I should say, we're not gonna go anywhere above that point. So some of the branches up there we're not gonna do on this particular model. Let's go ahead and do veins first, and then we'll do arteries after that. This is a superior vena cava, okay? It's going to split, and I'm gonna trace it for you, into the right brachiocephalic vein and left brachiocephalic vein. When do they change? They change right where that those internal jugulars come out, okay? Now let me remind you of something. This is my left, which means it's his right. This is my right. That means it's his left because we're looking at the anterior. So remember, we're switching those sides. All right, you wanna get good at practicing that. Okay, so how about these internal jugulars? You've got the right internal jugular vein and the left internal jugular vein, okay? So there's, it's like a little reverse L here and an L on this side. It's the internal jugular vein, and then this one is the subclavian vein. So we've got the right subclavian vein, and then right here we split. So from here to here, this is gonna be the right axillary vein. This one, it goes all the way down. That's gonna be the right cephalic vein, okay? We split here again, okay? And this one goes down. Let me trace it down. That's gonna be your right basilic vein, and the brachial is there, but then they cut it, so you don't really get much of a right brachial vein, which means there's not gonna be any radial or ulnar veins on this model, okay? Now, connecting the cephalic to the basilic, you've got this one here. It's called the right median cubital vein. Median, not medial, all right? Let's go down. We're gonna go down the inferior vena cava, okay? You can see the kidneys here. We've got a right and a left renal vein. Liver here, these are lobes now. You've got, I don't love the way this looks, but this is gonna be your left renal vein and hepatic vein, and this is gonna be your right hepatic vein. Remember, hepatic is liver, renal is kidney. This little guy here is the spleen. You can see this vein going into the spleen. That's going to be your splenic vein. Let's just finish these while we're here. We'll jump to arteries for a second. Splenic artery, because it's going into the spleen. And then you can see the renal arteries down here. These guys, like, boop, boop. I probably wouldn't do the arteries for the liver. Not loving the way that looks. Okay, remember, hepatic liver, renal kidney, splenic for spleen. All right, let's continue down. We're gonna split here. The inferior vena cava splits, and it's gonna split into the common iliac. So I'm just gonna go down one side. We have the right common iliac. This is common. Where does it change? Right here. See that little split? I got distracted for a second because my phone gave me a warning on battery. So this one is going to be the right internal iliac vein, and then the right external iliac goes to about there. And then they cut it. Why did you cut it? We don't know why they did that. Okay, so common iliac, right here it splits. This is veins. This is the internal iliac vein, external iliac vein. Now, we don't have the femoral vein where we would normally have it, which means all the branches of that we don't have. However, we've got this guy that runs down the medial aspect of the leg. That is called the great saphenous vein, okay? All right, so let's go back up. Back here, we've got the ascending aorta, the aortic arch, and you get your three branches, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery, okay? You have rights, but they come off of here. You have rights, but the right sides come off of the brachiocephalic trunk, which kind of tucks behind there. So this one is going to be your right common carotid artery. This was the left common carotid coming right, okay? This is going to be your right common carotid, okay? What's my other branches? So let's do the right subclavian artery. And I don't love it. Look what they did. well, I guess you can see it. You can see it. It's just kind of covered up a bit. We go here, so right here is where it's going to be stop being subclavian, and we're going to go from here to here, and we're going to call that the right axillary artery. It's not terrible. Then we come down here. This is brachial. So wait, so axillary ends about here. Use that as your landmark, right? The head of the humerus. And then so we're going to come down, and this is going to be right brachial artery, which splits, boom, right at the elbow. All right, bada boom, bada bang. So coming down the thumb side, remember anatomical position, thumbs out. This is going to be on the radial side, so it's called the right radial artery and the right ulnar artery. Very good. All right, so we did that. Let's come down now. Let's go into this area. Now, coming down, the posterior aspect of the heart, which you see on the heart videos, is the thoracic aorta, which right here, from this point down to here, is going to be the abdominal aorta. What's this point? Let's zoom in. This, see this guy here? It's a bunch of branches coming out. This is called the celiac trunk. So all of this is abdominal aorta from the celiac trunk down to the split. A couple branches coming off here. You've got this one here. It's called the superior mesenteric artery. And you got this little guy called the inferior mesenteric artery. I would never point to it on here because it goes off of the model. We could just point right there if I want inferior mesenteric artery. Anything in here is going to be abdominal aorta. All right, so the abdominal aorta is going to split into the common iliac arteries. Let's go down the one side. We're going to go down the left because this one goes all the way down on this side. So abdominal aorta splits into the left common iliac artery, and right there we get another split. This is the left internal iliac artery and the left external iliac artery right about there until we exit the bony pelvis. Then it becomes left femoral artery. So we've got, now pay attention to this because a lot of people miss the split. So we've got common iliac, internal, external, right? And then right here, we're gonna become left femoral artery, right about down to there-ish. Behind the knee, right about there, we're looking at the left popliteal artery, which splits into the left posterior tibial artery and the left anterior tibial artery. All right, that should do it for this model. If you have any questions, let me know. Stay strong. See you next time.